Hi, my name is Professor Adam Winstock. I'm a consultant psychiatrist and addiction medicine specialist and also founder of the Global Drug Survey. In this video, I want to talk about what we mean by alcohol withdrawal, what alcohol withdrawal symptoms are, and what they mean for your treatment. So as I said earlier, having alcohol withdrawal symptoms, that is the kind of experience of physical and psychological discomfort when a dependent drinker reduces or stops drinking is one of the diagnostic criteria that allows to say that someone is alcohol dependent, but it is neither sufficient or necessary in order for you to be labelled as alcohol dependent. But the truth is that most people who seek treatment probably experience some sort of physical withdrawal. But that physical withdrawal, its severity and its scope vary hugely. Now, a lot of people who are daily heavy regular drinkers don't experience physical withdrawal at all. And that's because they actually never go long enough without drinking to experience it. So I remember seeing a patient about 3 or 4 years ago, lady in her late 40s, had a good job, had a family, drank about a bottle of wine a day and had been sent to me because she had gone to a GP, she was hypertensive, she was overweight, and the GP took some liver function tests which were really high, and she disclosed she was drinking too much. And I found out what she was drinking, and then I said, what happens if you go a day without drinking? And she says, well, I don't. I come back from work, I start cooking, have some wine, and by the end of the night I've had a bottle of white wine, and I feel fine. And she couldn't remember the last day she'd gone without a drink. So I said, well, look, why don't you go away and maybe next week try and go a whole 48 hours, so not just like 24 hours, without having a drink, and then come back and tell me what happens. So this is what she said. She came back, she got back from work from 5 o'clock, she hadn't drunk for about 18 hours. And she said, I felt a little bit on edge because I always kind of drink when I cook. And but I kind of got through it, chatted to the kids, and then she went to bed. She said normally she slept without any problem at all. But on this night, coming up for 24 hours without any alcohol at all, she said she was quite physically restless and she couldn't kind of shut her mind off. And she kind of tossed and turned and really didn't feel very restless at all. She thinks she eventually kind of dropped off. She did say she didn't remember having to get up to have a pee during the night. By the following morning, she said she woke up and she was really feeling quite anxious. She had a lot on at work and she remembered being really quite snappy with the kids. But she managed to get to work, and she said by the time she got back to work, so this is now about 36 to 40 hours after her last drink, she said she was feeling really hot, she was really flushed, and that when she started to prepare dinner, she was aware of the fact that her hands were really quite clammy and that she was just aware of the very finest shake. And at that point, she opened a bottle of wine, drank half of it, and within a couple of hours, she was back to normal. And so she'd never thought she was alcohol dependent because she'd never experienced physical withdrawal. It was only by asking her to go through that experience that she recognised actually very quickly within 24 hours how her body had adapted to constant alcohol consumption. Now, actually, I'm not asking or suggesting anyone here stops drinking suddenly without medical supervision, because the one thing that's really important to know about alcohol withdrawal is it can be fatal. You don't die when you come off kind of cocaine or amphetamine or cannabis or even heroin, but stopping alcohol suddenly can be associated with seizures, delirium tremens. It can be fatal. But it's really important for you to understand what the relationship is between your daily drinking consumption and your alcohol withdrawal symptoms. The very earliest alcohol withdrawal symptoms people notice is that when they cut down or they drink less, it's just feeling internally uncomfortable, a little bit agitated, a little bit restless. The mind might be going a little bit kind of quicker. Then people notice that they start feeling really quite sweaty. They might notice their hands start becoming a little shaky. I mean, that shakiness can be very mild or it can be really severe. People also talk about feeling sick. They can develop a headache. People can become confused. They can see things. Lights and sounds become much more prominent. All of these things sit on a spectrum, and there are scales that doctors use to assess withdrawal severity, and that can guide treatment. But I think the purpose of this is to say that for most people, alcohol withdrawal starts somewhere between 6 and 24 hours after your last drink. It can take as much as 48 hours to kick in, but the withdrawal symptoms and the severity sit on a huge spectrum. I'd guess that probably half the people who are alcohol dependent don't have any physical withdrawal at all. I think for many people, the severity of their physical withdrawal means they may not even need treatment. But if you're someone who is waking up in the morning and by lunchtime, for example, has to have a drink, and if you don't have a drink, you're starting to shake and sweat and feel unwell or anxious, then you're someone who almost certainly needs a medical intervention to reduce the risk of that alcohol withdrawal progressing to something that can be severe and life-threatening. Now, treating alcohol withdrawal when it's assessed well and planned can be really safely done on an outpatient basis with the support of a significant other, unless you're someone who has a history of fits or seizures or delirium tremens, severe physical or psychiatric illness. You don't need to have this done in hospital. Interestingly, very often the first time alcohol withdrawal becomes apparent for many people is when they get admitted to hospital for other health conditions and suddenly find they have no access to alcohol. Alcohol withdrawal is not something to be frightened about. It's something to be aware about, and it's something to know that it can be treated really safely to get you through something that can be very difficult and very challenging. And because the experience of alcohol withdrawal can be so aversive and is the thing for many people that maintains their drinking, by knowing that it can be treated and it can be made really comfortable and over the space of 5 to 10 days can be managed, I hope that's something that's going to make you feel really confident about seeking treatment. In the next few videos, we're going to talk about actually what the treatment is for alcohol withdrawal and where for you might have that done.